Good morning, and welcome to this Oncology Data Advisor interview, which today we're having in honor of National Cancer Survivors Month in June. I have the honor of being joined by Darcy Burbage, who is an Oncology Clinical Nurse Specialist in Newark, Delaware. And today she's here to share some insights as well as her research in cancer survivorship. Darcy, thank you so much for coming on today.
Oh, thanks for inviting me, Kara. I'm excited.
Absolutely, looking forward to talking with you. To start off, I'd like to share a little bit about what you do and introduce yourself.
Sure. Well, thank you. As you mentioned, I'm an oncology clinical nurse specialist. I've been an oncology nurse my entire career and have worked in various roles, starting in inpatient setting and moved to clinical trials, research, and navigation. However, I've always been interested in the lived experiences of individuals after they've completed active treatment. When I initially began my career, there wasn't a lot of long-term survivors, but that quickly changed with advances in early detection and treatment modalities. So I did my master's research looking at self-transcendence and quality of life in breast cancer survivors. And then when I worked on my doctoral project, I actually looked at individuals living with advanced or metastatic cancer and starting a program that helped them, find their next and new normal. So I've really always had that interest in individuals living with cancer, if it's early stage or throughout the continuum of care.
Amazing. Looking forward to hearing some more about this work today. So, for background, like tell us a little bit about survivorship and, as you mentioned, how it's kind of evolved over time.
Right. Well, as I did mention that, it has evolved from individuals completing active treatment to those encompassing the entire continuum of care. The National Coalition of Cancer Survivorship defines a survivor as someone from the time of diagnosis through the balance of life. Um, and we have known that individuals, go through like a continuum of on treatment, managing long-term and late effects of treatment. So I was very fortunate. Back in 2006, you and your listeners may recall there was a report that was published by the Institute of Medicine called Lost in Translation from Cancer Patient to Cancer Survivor, which I think really had the whole oncology community doing a collective aha moment like, oh my God, how did we miss this? So, fortunately, because of that report, it really started the, re-evolution, so to speak, of survivorship, where accreditation programs such as the Commission on Cancer began requiring programs to address survivorship as part of their accreditation processes. And because of that, the health system where I worked at the time, I was asked to take on the role of developing and implementing a survivorship program for individuals at our health system, just to help them get back on track after they've completed treatment. And now, because of that, we recognize survivorship as more than just a single moment of time, but, a lifelong journey. Um, as we know, beginning at diagnosis and continues throughout and beyond treatment, that involves a comprehensive approach to survivorship that encompasses surveillance, risk reduction strategies, health promotion, as well as addressing the long term and late effects of treatment, be it physical or psychosocial effects, as well as the myriad of other issues that individuals face, such as financial toxicity, as well as managing comorbidities. So there's a lot that we need to do to help individuals live well after a diagnosis of cancer.
Absolutely. Thank you for the overview. No, there's also a lot of unique challenges that sometimes people might not even think of, such as language or terminology around survivorship. So, what are some of these kind of unique challenges that survivors face as they navigate the journey?
Right, that's a great question, Akira. They do encounter a lot of challenges throughout their continuum of care. Sometimes they're very deeply personal, and it may be invisible to others. For example, even the word survivor can be empowering for some, but others it's kind of triggering, especially if they're living with long-term or late effects, or perhaps they may be living with a metastatic or an advanced diagnosis and they'll be in treatment for the remainder of their lives. Um, Other well-meaning comments, which are, "Oh, you look great," or "Aren't you glad it's all behind you?" Are some things that can really invalidate the ongoing struggles that individuals living with a cancer diagnosis face. Also, if they're still experiencing some side effects such as fatigue, anxieties, or even fear of recurrence. And you also mentioned like triggers. Other triggers could be anniversaries, the anniversary of their diagnosis, when they entered or completed treatment, or perhaps if they went through treatment, during the holiday time. Another big trigger is, we've all heard it, like scanxiety, waiting for test results. And sometimes that can feel like forever. And we think, oh, it's only a 24, 48 hours. But to a survivor or an individual waiting for those results, it can feel like a lifetime. So that can be very distressing and, trigger trauma as well. And there's also stressors associated with reintegration back into your life before treatment, if it's returning to work, intimacy with a partner, and also daily roles, because the show must go on for others. If you have work responsibilities, if you have family responsibilities, sometimes those shift. And as you venture further from treatment, you want to get back into your next normal, and it's sometimes they felt like other people have moved on without them. So survivors may feel a disconnect between like the, external expectations as well as what they're, internalizing themselves. So there's a lot that they're left to deal with. So those are, great questions that we as clinicians need to like ask our survivors, about how we can help them.
Absolutely. I like how you mentioned the invisible challenges. Even though someone looks like they might be doing great, there's always a lot going on behind the scenes that we don't know about. So, like you said, it's important to ask questions and figure out how we can help.
Right, right.
Right. So, I know another big topic for you is nurse navigation. So, how is this used in the survivorship journey?
Yes. Well, nurse navigators are critical in survivorship care. We serve as a consistent point of contact, coordinating follow-up care, addressing barriers to care even within survivorship, and help patients access the care they need. If it's ongoing physical, if it's rehabilitation, if it's psychosocial support, addressing financial toxicity, because once treatment is over, sometimes the bills start to drop and it's like, oh my goodness, where do I go from here? And every day it's something. um, we also help to anticipate those barriers of care, ensuring that survivors don't feel abandoned at the end of treatment, because we're very excited for our patients that they finish treatment, and so are they. But then it's like, oh, I'm not going to see them every day or not as frequently. And they always feel like, am I bothering them? I shouldn't have this many questions. Or a lot of questions I get from individuals, Kara, is, who do I call? I now have a surgeon, a medical oncologist, a radiation oncologist, in addition to a primary care provider, or if it's a GYN. So, who do I call if I'm having these ongoing symptoms? And what I usually tell my survivors and patients is, call me. Let's talk through these. One, I'm easier to get a hold of, probably, and we can talk through some of the experiences that you're having and I can help get you into that next appointment so you don't feel abandoned, and wondering if, waiting a week or two is sufficient, or if we need to get you in sooner. So, we really advocate for patients regardless of where they are. So we don't, we're always part of their team. And I tell my patients, I work for you. So whatever you need, feel free to, call me. And regardless of where you are, I have individuals that may be like 6 months or even later saying, do you remember me? I have a question. So just having that trusting, ongoing relationship is very important. And I help to encourage that in individuals. And I'm fortunate that they feel comfortable in calling me, and I still want to be helpful to them at this point as well.
That's amazing. Such a crucial role, and I'm sure it's such a relief for patients to have a designated person they can reach out to help with all their questions.
Absolutely. I want a navigator, you know?
Yeah, awesome. So, what are some other things that clinicians can do to help support their patients navigating survivorship? And I know you also have an upcoming presentation at MASCC about this topic.
Yes. Well, along those same lines, it's really important for clinicians to assess survivors and address those ongoing concerns. There's a lot of evidence-based resources we can use that have been tested, patient-reported outcomes. Sometimes they're electronic, sometimes they're paper form, where individuals can tell us what they're experiencing. Most of the time, it's on a 1 to 10 scale. So, we can find out where they are in their journey and where we need to focus on helping them, advocate for, ongoing, rehabilitation, or getting into a palliative care program where they're experts in symptom management if it's ongoing pain or lymphedema that doesn't seem to be managed, as well as it could be, or speech therapy. So those are some things that we really need to do. Or if it's back with a social worker to help mitigate some of the financial toxicity that they're experiencing. So it kind of can help validate where they are in the continuum of care. So I kind of like term it like, recognize, reassure, and refer, because sometimes that first cough or cold after treatment, the first thought is, oh my gosh, it's coming back. Now it's in my lungs, or, and that's scary, so talking it through and say, tell me about those experiences. Tell me what you're feeling. Sometimes it could just be, a cough or cold, especially if it's that time of year or allergy season. So we, kind of help them, turn within themselves and say, let's tell me a little bit more about this. So another thing that I do, that I'll also be talking a bit about at MASC, is motivational interviewing. So that's another component of evidence-based care. It's patient-centered. Um, it empowers individuals to make a change, as it, helps guide survivors towards their own solutions rather than the clinician, nurse, doctor, um, prescribing like, oh, you need to exercise more. It helps them uncover what they need to do. So, we can say, tell me a little bit about, the fatigue. You said you were experiencing some fatigue on this form that you completed, and I know you're heading back to work. How have you been managing that? So, really delving into a little bit more detail about the level of fatigue, how they're experiencing it, how they're managing it, and allowing us as the clinician to provide more education that, believe it or not, moving more can really help reduce fatigue. So, have you tried exercise? Is that something that you want to consider? Helping them set a goal. Maybe it's, 10 minutes a day, I'm going to exercise, if it's just walking, and then following up with them. So, our role is to help support them in reaching their goals. So what we found is that survivorship programs that integrate motivational interviewing literally empowers individuals to help define what wellness looks like to them and reclaim a sense of control that they may have lost during their treatment. So I found it's really been helpful, and we've have from our survivors have told us that they felt the same way. They felt that they're part of the solution rather than just one more thing, do this, do that. So they're really working to help themselves, and we're supporting them on that journey.
That's amazing. Such an innovative approach, and looking forward to hearing more at the about the mask presentation as well.
Yeah. Yeah. Well, my presentation, it's part of a half-day program at MASCC, which is the Multinational Association of Supportive Care and Cancer. So myself, and there's two physicians. One is a primary care provider who provides survivorship support at Dana-Farber, and then a medical oncologist who works out of their program in Adelaide, Australia. So it's called Beyond Survivorship 101. So what we've learned about survivorship, just like navigation, there's not a one size fits all program. So what works in your program for your community. So what I'll be discussing is how motivational interviewing can help in a survivorship program, and a nurse navigator can implement that within their program. So the physicians will be talking about how to, provide a clinic consultation for those programs that one may have a freestanding program, and Dr. Jefford, who doesn't have a freestanding program but incorporates survivorship within his medical oncology clinic, and in a community program where I was based, how we incorporated motivational interviewing to help our survivors get back on track.
That's amazing. It's great that there's a designated presentation for this at Mass to really spread the word about motivational interviewing.
Yes, I'm looking forward to it, and there's still time to register if anyone's interested. It's June 27th in Seattle. So just
Awesome.
FYI.
Cool. Awesome. So I guess as we wrap up today, all of this information has been so valuable for understanding the survivorship journey and the challenges and complexities go along with it. So in honor of National Cancer Survivors Month, are there any take-home messages that you'd like to share with both patients and clinicians on this topic?
Yes. First, I'd like to just say to our survivors, your story is unique and it's powerful, and you don't have to fit a specific definition. Whether you're living with, beyond, have finished treatment, your story is powerful. It's your own experience, and it's validating whatever your hopes and fears are. They're real, and don't be afraid to share them with your clinicians, with your family, so we can help you get back on track. And to my, fellow clinicians, nurses, you know, physicians, physical therapists, psychologists, primary care providers. It's a team effort. Not one of us can do it all. We need to continue to show up with empathy, with curiosity, with humility, and really let the patients lead. And we need to continue to be their advocate, their guide, and their champion through this part of the journey. So, what I'd like for all of us to do is like honor all of those individuals whose lives have been touched by cancer, and recommit ourselves to, being providing, holistic patient-centered care, and recognize that survivorship is a dynamic, evolving part of the continuum of care. So I just thank you for this opportunity, and I'm proud to be a part of wherever I can do to help individuals get back on track with their part of their life, of living beyond a cancer diagnosis and with it.
Absolutely. Well, thank you so much, Darcy. This has been an incredible conversation. I'm sure it'll be very empowering for our audience, both patients and clinicians alike. So thank you again for coming on to share your insights and also for all the work you do to help survivors navigate this journey.
Well, thank you, Kara. It's been my pleasure. Thank you so much.